In a society that believes in equal access to the best healthcare treatments for everyone, costs are becoming unsustainable. So how can we change the way that healthcare is provided without denying people access to treatments? Well, new research is showing that if we target healthcare to individuals instead of treating everyone in the same way, not only will we save healthcare dollars, but health outcomes will improve as well.
Just get a bit of an idea of
One of the ways this has been considered is to say, instead of treating healthcare problems generically, if we can start better understanding the specific healthcare needs of each individual in terms of their risk for developing disease, and then when they're diagnosed with disease, how it should be managed, we'll be able to do a better job.
And that's because a specific treatment that works in one person may not work in another person with the same disease.
Exactly. We've known that for a while. For instance, Herceptin, or trastuzumab, has been a wonder drug for some of the 15% of women whose breast cancers have HER2 overexpression. Not all of them benefit.
And this is really important. There are more than 10 types of breast cancer, and not all of them respond to Herceptin.
And Herceptin is expensive, around $30,000 per person treated.
So giving it to people who won't benefit from it is pouring our precious healthcare dollars down the drain. But more importantly, you don't want to be wasting your time with a treatment that doesn't work and may cause you harm.
The process of personalizing disease control should really be thought of as trying to spend our dollars where they're going to count the most. By using the known risk factors for ovarian cancer, for instance, women with BRCA1 and 2 are at high risk for the most common type of ovarian cancer. So whenever that cancer is diagnosed, if those women are offered BRCA1 and 2 testing, and then if they have a mutation, carrier testing is offered to family members, we can have a further reduction in risk.
So how much more accurate are we becoming by mapping the genome? That's the entire set of genes that make up the chromosomes of an individual, compared to, say, looking at family history.
Interpreting the information which is in a genome right now is largely beyond our abilities at this point. We can understand bits of the genome. By studying families, it helps us sort out what's going on, because if you have two people who are related, particularly if they're distantly related, but we know they're connected, who have an unusual disease, and we compare their genomes, the bits which they share are likely the bits which carry that trait. So family studies are still very important.
So at what point should an individual be looking at having their genes mapped? Once they've been diagnosed with a disease, or much earlier, maybe at birth?
This is a really good question, and it's a really exciting question, because a human genome sequence is unlike any diagnostic which has been offered before, because it could be useful for you for many different purposes. It will carry information which could be useful for family members. However, there are risks incumbent in this as well. Issues such as how to safely store the information, how we can harness the useful aspects and prevent people from being discriminated against based on things they can't control, or things which appear in their genome which may actually never play out in any way, but could maybe used in some kind of discriminatory fashion.
These risks are very real, particularly for some conditions involving mental health or long-term chronic illness, where significant levels of bias still exist. And the other thing that experience tells us is that once you create the information, it is almost impossible to keep it totally secure. Some countries have specific legislation to protect people from discrimination based on genetic information. The US has GINA, the Genetic Information Non-Discrimination Act, but Australia and many other countries have no protection.
It's going to take a large amount of engagement from a broad range of different types of researchers and the general public, who are going to have to be partners in this research, to determine how we can use genomics. Not talking about just testing specific genes in cancers or in individuals with family histories of disease, but full genomics, safely and effectively. It's a very exciting endeavor, and it's going to bring a lot of people together.
One of the challenges is that whilst the person having the genome tested may be willing to accept the risk of disclosure, family members who share the same genetic material may not want to take that risk.
You can have families where you have very different sort of views of privacy within a family. And you may have some parts of a family who are very private and like to keep things like a risk for cancer as a very personal kind of secret, which they may share with close family members only and just deal with on a medical basis. And they may have a relative, though, who you're also working with who wants to post their genetic testing results on Facebook. And that can cause a lot of issues. But there are many things which cause issues in families.
Although mapping the genome of individuals has the promise to deliver better health outcomes with huge savings, it's a complex issue and one that hasn't had sufficient public attention and debate. Some governments are moving much slower than advances in technology, which is leaving their most vulnerable people unprotected.